So we'll get started. My name is Roma. I'm the SHIP coordinator for the Pikes Peak Area Agency on Aging through the Pikes Peak Area Council of Governments. And we are going to be talking about Medicare, everybody's favorite subject. Today, we're going to be covering Medicare A and B, what it covers, what it costs, what it doesn't cover, how to get it, how to enroll in it. Hopefully everybody who's logging in virtually received the email that included the slides and the handouts that we're going to be, so that you could follow along, and the handouts that I'm going to be referencing. Everybody here in person has their folder. I am happy to take questions during the presentation. I will pause a few times throughout the presentation to see if anybody has any questions, and then I will be around for as long as necessary if anybody has questions at the end. We'll try and get through this as quickly as we can, but yeah, if you have questions, if those who are attending virtually have questions, simply please type your question into the chat box, or if you want to ask your question through the microphone, when I pause for questions, you're welcome to raise your hand and we'll get your question asked. All right, I think that's all the housekeeping. So again, we're going to talk about Medicare A and B today. Next week, we'll talk about something else, insurance to go with A and B, but we're going to focus on everything that A and B of Medicare does today. Again, we are at the Area Agency on Aging. The mission of the Area Agency on Aging is to work with our partner governments, which are in Park, El Paso, and Teller counties, to develop systems and programs that allow people to stay in their homes and in the community for as long as possible, and to advocate for older adults in Colorado. I am the coordinator for the SHIP program, which stands for State Health Insurance Assistance Program. This is a federally funded program that provides free, unbiased information and education. We don't sell anything. We don't endorse any specific companies or insurance plans. We are consumer advocates. So we provide education, assistance, and information about any and everything related to Medicare, including employer coverage, long-term care insurance, Medicaid, you name it. If it can intersect with Medicare, then we can help you with it. For this specific program within the Area Agency on Aging, I actually cover 9 counties of Colorado, and those are listed on the slide. Every county and every state has access to someone in the SHIP program for this kind of assistance and advocacy. I've included our local Colorado Springs number as well as the statewide toll-free number. If you call the toll-free number from anywhere in the state, it's going to ask you what county you're calling from and route you to the SHIP program closest to you. So there are 3 primary parts to Medicare: Medicare A and Medicare B, and then the newest part of Medicare, Medicare D. D stands for drugs. That's the new prescription benefit. You may have also heard the term Part C, which refers to Medicare Advantage plans. Technically, it's not actually a part of Medicare, but Part C is interchangeable with the private health insurance options of Medicare Advantage plans. We're only going to talk about A and B today. And we're going to start with who runs Medicare. In order to enroll in Medicare, you have to go through Social Security. It is Social Security who determines who is eligible for Medicare based on work history. They process Medicare enrollments. They issue the Medicare ID card. But once you're enrolled in Medicare, they want nothing to do with it. So all they do is enroll you and tell you if you're eligible. Once you're enrolled in Medicare, any questions or information that you would need would come from the Centers for Medicare and Medicaid Services, otherwise known as CMS. I'm simply going to refer to them as Medicare. CMS is who determines benefits. They administer the program. They process the claims. They pay the providers. Medicare is only available online or by phone. They have no brick and mortar locations. So you can contact them 24 hours a day, 7 days a week, 365 days a year by chat. You can go to their website or you can call the toll-free Medicare 1-800-Medicare number. Local Social Security offices, we do have one here in Colorado Springs. They're regional. Or you can call the toll-free number, the national number for Social Security, which is available Monday through Friday, 7 a.m. to 7 p.m. in all time zones. You could also go to the Social Security website. Within that website, you have the ability to create a personalized Social Security account, which I encourage you to do. It is not required, but I can honestly say it is going to be the preferred way to enroll in Medicare versus talking to Social Security. Social Security no longer accepts walk-ins at the local offices or the regional offices. As of 1/6 of this year, they've gone to appointments only. And I can tell you getting an appointment can be kind of tough right now. Last I heard, they were 3 months out at minimum. Actually, the last I heard, they were not taking appointments because they were beyond 3 months out. But you can do almost anything that you would do in person, online, and through a personalized account. A personalized account is not required to enroll in Medicare online through the Social Security website, but it is helpful, and it has gives you the ability to look at estimated income amounts. You can submit applications. You can see any documents that Social Security would be sending to you online in real time versus waiting 2 to 4 weeks to get it in the mail, that kind of thing. Very, very secure because they use government ID processing websites for that. But yeah, keep that in mind. If you're looking to need to enroll in Medicare anytime soon, your best bet is to do it online. So, who can have Medicare? If you are a U.S. citizen and you are becoming age 65 or older, you will automatically be eligible for Medicare if you have contributed into the tax system, primarily through employer taxes. You could also have contributed through the railroad retirement system, or if you're self-employed, paid your own Social Security taxes. But the general age of eligibility is still 65, even though the age of full retirement for income purposes has increased to 66 and some months. You can also become eligible if you have been determined to be disabled by Social Security under age 65 and have been on disability or have been receiving payments for at least 2 years. You can become eligible any age if you're diagnosed with end-stage renal disease, kidney disease, and are receiving dialysis. If you're diagnosed with Lou Gehrig's disease or ALS. And then any lawfully admitted resident alien who has resided in this country for at least 5 years is entitled to purchase Medicare. There are specific timeframes for enrolling in Medicare. They're called just enrollment periods. For people who are becoming eligible for Medicare based on turning 65, that is going to be your initial enrollment period. And that initial enrollment period to enroll in Medicare is going to be the 3 months prior to the month of your 65th birthday, the month of, and then up to 3 months after the month of your 65th birthday. That is your window of opportunity to enroll in Medicare, although Medicare will not start any sooner than the first day of the month of your 65th birthday. So it doesn't matter what day of the month your birthday is on, Medicare starts and stops benefits or programs at the first of a month. So it's always going to, unless your birthday is the first day of the month, and then you get to start the month before that. When you enroll in Medicare, the month of or any of the 3 months after, your benefits become effective the first day of the next month. Previously, up until about 2 years ago, if you enrolled in month 5 or 6 or 7, there was a delay of 2 or 3 months before your benefits would actually start. They've changed that to the first day of the next month. Other times you could potentially enroll if you do not enroll during your initial enrollment period surrounding that 65th birthday. Special enrollment periods are opportunities to enroll in Medicare because you continued to be employed and had health coverage through that employment past age 65. So if you are still actively employed and you have health insurance through that employment, and there's at least 20 employees working at that company, you can delay enrollment into any part of Medicare because of that active health insurance through employment. When you decide to stop working and lose that active employment status and that health insurance associated with it, you would have up to 8 months to enroll in Medicare from the time that employment ended without penalty. Or you can enroll in Medicare anytime while you're still actively working. It is basically the only excuse Social Security will accept for not enrolling at Medicare at 65 and not penalizing you, is if you delayed it because you were actively employed and had employer group coverage. And that employer group coverage, that special enrollment period also applies to a spouse if the spouse is covered under your employer group coverage through your active work. If for some reason you don't enroll in Medicare during your initial enrollment period, you don't fall under a special enrollment opportunity, you can still enroll in Medicare any year down the road during the general enrollment period. The general enrollment period every year is January 1st through March 31st. I keep forgetting to change this slide. It used to be that if you enrolled during those 3 months, the general enrollment period, your coverage would not start until July of that year. That has changed about 2 years ago. It is now going to start the first day of the next month. If you're enrolling during this general enrollment period, you're likely going to incur a penalty, meaning you're going to pay higher premiums for not having enrolled during your initial enrollment or falling under the special enrollment opportunities. This is just what the new Medicare card looks like. It's simply going to have your name. It's going to have your Medicare ID number, which is no longer a Social Security number. And it's going to show the dates that Medicare Part A and or B went into effect. That's all it has. You no longer have to sign it. It no longer has Social Security numbers as the ID number. I typically refer to it as the red, white, and blue card. A couple of things to make sure that you have up to speed when you're getting ready to enroll in Medicare. You want to make sure that your mailing address and information is current in Social Security, because whatever information is online at Social Security or in that system is where that card is going to be mailed to. And just a little warning, if anybody tries to call you during the time surrounding that 65th birthday, trying to confirm that you've received your Medicare card, it is probably a scam, because Social Security does not call you. And nobody's going to check to see if you've ever received your card. It's your responsibility, if you don't get it, to contact them and find out why. Another handout that I've included, either in the email or in the packets, I included a couple of handouts on what you can do at the Social Security website and a handout on the process for enrolling in Medicare through the Social Security website. I also included a handout on how to create your own personalized account on the Medicare.gov website. Those are two separate accounts, SSA.gov and Medicare.gov. It is much simpler to create an account at Medicare.gov, although it is still just as secure. Again, nobody requires that you have these accounts on either of those websites. They can come in handy, but they are absolutely not required. At least not yet. Any questions about any of that so far? Okay. So the question is, does TRICARE count as insurance, or are you talking about to delay Medicare? So the way that works is, if you are on TRICARE and you become eligible for Medicare and you're not actively working and have employer coverage through that work, TRICARE is going to require that you enroll in Medicare. And then that TRICARE Standard or Prime or whatever you have now turns into TRICARE for Life and automatically supplements A and B of Medicare. And to be quite honest, if you have Medicare and TRICARE for life, you don't need anything else, ever. It is literally probably the best coverage available in this country today. So if the spouse, if you're eligible for TRICARE as well, when you turn 65 and get Medicare, your TRICARE standard or prime will also turn into TRICARE for life. Yeah. Yep. As long as you guys are still married, you should still be able to access that. Absolutely. Yep. Yeah. To get enrolled in Medicare now. So Medicare.gov once you have Medicare, but to get enrolled in Medicare, SSA.gov. Absolutely. Now, and that's for people who are maybe still working, not collecting Social Security income. If you are collecting a Social Security income, whether it's early retirement, disability, doesn't matter. If you're collecting an income when you become eligible for Medicare, Social Security will automatically enroll you in Medicare and automatically send you a card because you're already collecting an income. But if you're not collecting a Social Security income, it becomes your responsibility to enroll when you choose to enroll under either of those scenarios. So active employment with employer coverage is the only excuse Social Security will allow to delay enrollment into Medicare without penalty. But if you are collecting a Social Security income, you will automatically be enrolled and they will automatically start taking the premium out of your Medicare or your Social Security for Medicare. And that way you don't get penalized for not enrolling on time. Any other questions? Yes. Mm-hmm. So if you're the active employee and you're the one who has the insurance through that employment and that insurance also covers a spouse, then yes, as long as you are still working, the spouse can delay enrollment into Medicare, or the spouse can drop off the employer coverage and enroll in Medicare and go that route. Absolutely. As long as someone's still covered under active employer insurance, Medicare is going to be secondary to that. So the employer insurance becomes the primary payer. Medicare would be secondary to that. Now, a lot of people will go ahead and enroll in Part A of Medicare, and we'll talk about why in a minute, but not Part B because that's the part you have to pay for. Depending on what kind of setup you have through employer coverage, so if you have like a high deductible plan and then a savings account to cover that high deductible, there could be some advantage of enrolling in Medicare because Medicare will pay secondary to the employer plan. So if the employer plan pays nothing until you spend $5,000, during that $5,000 deductible, Medicare can be billed as secondary and Medicare will pay their part as if they were primary. If you don't have a high deductible plan and say you have a $500 deductible and then your insurance pays 80/20, they're going to pay the majority. Medicare is still going to process as secondary, but they would pay 80/20. And if the employer plan paid 80/20 and Medicare would pay 80/20, Medicare is not going to make any additional payment after the employer plan. So depending on the kind of insurance you have through that employer, it may or may not be advantageous to pay that extra premium to have the Medicare. Because basically you're just paying for two insurances and one of them may not have any financial benefit. So yeah, it pays to review that on a case by case basis because there's a lot of different ways employer plans work these days, for sure. So I do have a question online that I'll address real quick here. Company health insurance will continue till the end of March. Does that affect how and when my wife and I apply for Part B? I already have Part A. So because you know, Gary, that you know when your employer coverage ends, You can enroll in Medicare to coordinate with the end of that employer coverage, so that at the end of the month, at the end of February, or end of March, when your employer coverage stops, Medicare Part B goes into effect for April 1. And that would be the best way to do it. And because you're already enrolled in Part A, that process becomes a little easier. But again, probably going to want to do it online. So hopefully that answered that question. All right. So we've kind of talked about a lot of this already. Things to consider as to whether or not you want to enroll or need to enroll in Medicare Part A. Again, if you're collecting an income from Social Security is going to automatically enroll you to be effective the first day of the month of your 65th birthday, or the month of eligibility if you're on disability. Employer coverage for you and or your spouse, again, is the only good excuse Social Security will accept for delayed enrollment past your initial enrollment period surrounding the 65th birthday. For most people, in order to earn Medicare Part A at no cost, you have to have paid into the tax system, paid Social Security tax through employment for at least 10 years or 40 working quarters. And that's accumulated at any point during your working lifetime. So if you accumulate those 10 years right out of high school, as soon as you have those 10 years, it doesn't matter when you retire, you get Part A at no cost. For those that do not accumulate those 40 quarters or those 10 years of work history paid into the tax system, when you become eligible at 65, you can purchase Medicare Part A, but it is not cheap. Part A by itself for 32 or less quarters, $518 this year. It's a little bit less if you have between 32 and 40 quarters, but still, it's not cheap, and that's just for Part A. Now, some people say you were a stay-at-home parent and maybe didn't have that work history. If you are married to a spouse that does have at least 10 years, it is possible that you could collect Part A at no cost based on the spouse's work history, as long as you've been married for 10 years or more. So what does Part A cover? My easiest rule of thumb is Part A covers inpatient, Part B covers outpatient. So Part A is going to cover all of your inpatient medical needs, including inpatient hospitalization. Medicare Part A will cover all inpatient hospital costs, whether you're there 1 day or 60 days, minus a deductible. So every time you're admitted to the hospital as an inpatient, Medicare will pay the whole stay, regardless of what you're there for, except for this year, a $1,676 deductible. That is applied per admission, not per year. So if you have multiple inpatient hospital admissions within a year, that deductible could be applied multiple times. And that covers you up to 60 consecutive days per admission. If you're there longer than 60 consecutive days, Medicare will continue to pay for that stay, but they will start applying what they call a coinsurance, meaning they'll pay everything per day except for this year $419, starting at day 61. And then if you're there longer than 90 days, that coinsurance goes up to $838. Fortunately, they don't like to keep us in the hospital that long anymore. They want to get you in and out as quick as possible. So that would be a very rare scenario to be in for 60 days to begin with. But if you were to reach that 90-day mark or beyond, you start going into lifetime reserve days, and you only get 60 of those past 90 days for your lifetime. So hopefully that never applies to any of us, but that's the max that Medicare will pay. They will pay an unlimited number of times up to 90 days. But beyond 90 days, they'll only cover another 60 days, and then it starts, and the benefits will cut off beyond a 90-day period. You have to have at least 60 days from the time you are discharged from an inpatient stay to the time you are readmitted before you start a new benefit period, and they can apply a new deductible. So at least 60 days in between stays before they can apply a new $1,600 deductible. The same rule applies for inpatient psychiatric hospitals, although Medicare does put a maximum number of days they will cover inpatient psychiatric hospitalization at 190. There is no limit for medical hospitalization. And during that inpatient stay, Medicare will cover all of the costs for all services that you're receiving, medications, surgeries, whatever you're there for. However, there are some things that Part A will not pay for, and that includes a private hospital room, unless it's deemed medically necessary and ordered by a doctor for some reason. No part of Medicare will pay for any of the first 3 pints of replacement blood someone might need. I don't know why. Does not cover private duty nurses or room sitters while you're in the hospital, and does not cover what they consider self-administered drugs. When I say self-administered drugs, that's typically prescription drugs that you're given on the day of discharge. On the day of discharge, you're no longer considered inpatient. And if they're taking forever to get you discharged from the hospital, and in the meantime, it comes time for you to take your maintenance medication, your heart medication or whatever, and they come into your room and they hand you a cup of pills to take, and you swallow those pills, you just self-administer drugs, and they can bill you privately for that because you're not considered inpatient on the day of discharge. And that's the most common scenario that you're going to see that. Now, having said that, if you have a prescription plan, a Part D plan, or prescription coverage from another source, and you get a bill for something like that, you can submit that bill to those benefits and get reimbursed minus copays probably. Part A also covers skilled nursing facility. So in order for Medicare to cover your stay in a skilled nursing facility for recovery or rehab, Medicare does require that you have been in the hospital as an inpatient for at least 3 consecutive days before you can be discharged into a skilled facility for rehab or recovery, and Medicare will pay for it. If you've not been in the hospital for 3 days and they try and discharge you to a rehab, Medicare is not going to pay for that rehab stay. So you have to have at least 3 days as an inpatient. If you have those 3-day requirements, inpatient days, and you are discharged into a rehab for recovery or rehab, Medicare will pay 100% for the first 20 days of that inpatient rehab stay. Then starting at day 21, if you're longer than 20 days, starting at day 21, Medicare will continue to pay everything for that continued stay, except for a daily coinsurance. This year it's $209.50 per day. So the first 20 days are covered at 100%. From day 21 up to day 100, which is the max, Medicare pays everything except $209.50 per day. If you're still in that facility on day 101, Medicare coverage stops completely. Because at that point, Medicare is going to say you have not gotten well enough in this facility to go home, even if it's to go home with continued rehab at home. You have not been able to leave this facility. The likelihood of you leaving this facility becomes smaller and smaller, and they consider it a custodial stay starting at day 101 or long-term care stay, and they do not cover long-term care. So you get up to 100 days that Medicare pays all or part of covered needs. You get an unlimited number of these 100-day periods for the rest of your life. So there's no limit to how often you can be in that scenario, as long as you have that 3-day hospital stay prior to admission to the facility. But you can't be there for longer than 100 days. The last benefits covered through Medicare Part A are going to be some home health care and hospice care. Both of those services do require a doctor certify that you're eligible to receive those kinds of care. Medicare deductibles do not apply. Most of the services received under those 2 benefits are paid at 100%, with the exception of maybe some medical equipment. So if you're getting home health care and the doctor orders a wheelchair for you, that does get billed to Part B. It doesn't come under the Part A benefit. And there are some limits. However, Medicare did remove a lot of the limits on how long someone can receive home health care under this part of Medicare. So it used to be limited to like $1,800 a year. And now, as long as the doctor can prove that you are continuing to improve with the in-home rehab or physical therapy or what have you under this home health care benefit, they will continue to pay for you to get that care. For the hospice benefit, Medicare will pay for anything that is provided that is designed to make you comfortable in an end-of-life scenario. So it will pay for any equipment. It will pay for any medications to make you comfortable. It will pay for anything and everything except for room and board. So if you're on hospice at home, you should have no out-of-pocket cost, not even for medical equipment. The criteria for hospice, the doctor does have to certify that you are potentially within 6 months of life expectancy. That certainly does not mean someone has to die within 6 months to receive that benefit, and there is no limit to how long someone can be on hospice, as long as they continue to meet the eligibility. Both of those benefits have to be recertified by a doctor every 60 to 90 days to tell Medicare you still meet the criteria to get covered under those services. So that is Part A in a nutshell. Any questions about Part A? Okay. Now we'll talk about Part B. Again, my rule of thumb is Part A is inpatient, Part B is outpatient. Part B is the part of Medicare that everybody has to pay for. Everybody pays a premium. Again, if you are already collecting a Social Security income, not only will Social Security automatically enroll you in Medicare when you become eligible, but they will also automatically start deducting the Part B premium from that Social Security income. Again, can delay enrollment if you're actively employed or the spouse of someone actively employed and covered under employer insurance. There is a base premium for Medicare Part B, but if you have a higher annual income, you may have to pay a higher Part B premium. Premiums became means tested several years ago, so if you have a high annual income, you may pay a higher premium. There are some scenarios where you may need to enroll in Medicare Part B and some scenarios where you may not. Someone who is on TRICARE and not actively employed with employer coverage is a perfect example of someone who would need to enroll in Part B when you become eligible because you are on TRICARE. If you don't enroll in Part B, you could potentially lose all TRICARE benefit. So they require that you enroll in Medicare if you are on TRICARE. You would have to have both A and B if you want to enroll in a Medicare supplement or Medigap policy, or if you wanted to enroll in a Medicare Advantage plan. I get a lot of veterans who ask me, they're not retired military, they're just veterans, who ask me if they need to enroll in Part B because they use the VA health system for all of their care. The VA health system is not considered a credible reason to not enroll in Medicare. So enrolling in Medicare and any part of Medicare, quite frankly, is optional. Nobody says you're required to do any of that. But for veterans who choose not to enroll in Part B, and they can absolutely choose to do that, but if they decide at some point down the road that having Part B would be to their advantage, they can enroll during general enrollment, but they will be penalized. They'll have to pay a higher premium based on not enrolling when they first became eligible, because VA health system is not considered credible insurance. The advantage of enrolling in Part B if you're a veteran is that, yeah, here in Colorado Springs, we are surrounded by military bases. We have some VA facilities. But if you're not in an area where a VA facility is as convenient or handy, having Medicare A and B, which is good anywhere in this country for any medical need, no matter what, can be the advantage. VA and Medicare do not coordinate with each other. So if you go to VA and you have to pay a copay there, you can't bill that to Medicare and vice versa. But there are advantages to having both. And penalties if you don't enroll in Part B but decide you need it later. Sure. Correct. You can delay. Yes. That's so the question is, will you be penalized for Part B if you have employer coverage? That is, again, the only excuse Social Security will accept for not penalizing you. So if you are actively employed or you're the spouse of someone actively employed and you're covered by that employer health insurance, no penalties down the road. Because that is the only excuse Social Security accepts for not enrolling when you first became eligible. Every other scenario for not enrolling does typically incur a penalty. And a lot of people will just enroll in Part A because it's no cost. Yep. Yes. Yeah, and most people do that. And Social Security, honestly, I think encourages people to just go ahead and enroll in Part A. Although it's not required, you can delay both parts, but Social Security does encourage you to go ahead and enroll in Part A. And I think that just makes the process of enrolling Part B later a little easier because you're already in the system. So yeah, that would, I mean, there's no reason to have both if you have relatively good employer coverage. There's not usually any financial advantage to have both Part A and B. So yeah, that's pretty common strategy. And there's no downside to it. And there could be some potential upside to having Part A if you have a high deductible or if you have any deductible for inpatient care. Because Medicare can still be billed secondary for inpatient care. And if the out-of-pocket cost left over by the employer plan is greater than $1,676 deductible that Medicare applies, Medicare will pay the difference for inpatient hospitalization. So yeah, there's no downside. So, I mean, I think that pretty much covers most of what's on this slide. Active employment is the only good excuse.
And Romo, before we continue, William
Yes.
did have a question in the chat.
Question is, if you have active employer group insurance and do not plan to retire, how do you know the employer insurance is credible and would you allow to delay enrollment? So the rule is active employer health insurance from an employer with at least 20 employees. It doesn't matter how good it is or not. What is important is that it's from active employment with an employer of at least 20 employees. So it doesn't matter if it's considered good or creditable. It's creditable because it's through active employment. So yes, you would be able to delay until that employment ends or that coverage ends and enroll in Medicare without penalty later. Absolutely. So how much does Part B cost? Well, it went up about $10 this year. $185 is the base premium. Again, it may be higher if you have a higher annual income, still working or what have you. If you're collecting Social Security, again, that premium is automatically deducted from that income. If you enroll in Part B and you're waiting to collect Social Security until full retirement age, which is 66 and some months right now. Actually, it might be at 67 right now. It is at 67 now. So if you wait for full retirement age before you start collecting Social Security, but you go ahead and enroll in Part B prior to Social Security income being received, you'll be billed the Part B premium. And that can happen in one of two ways. You can either be billed quarterly through the mail, or you can have it, they finally set it up so you can have that premium automatically deducted from a bank account every month. That is the way to go, because getting a paper bill every 3 months is quite frankly a nightmare. By the time you get the bill, it is already past due. And it takes them weeks to process it once you send in that payment. So you get the first 3-month bill, and then you immediately set up automatic draft is the way to go. And then as soon as you start collecting Social Security, that premium starts being deducted automatically. They'll no longer allow you to pay it separately. If for some reason you do incur a penalty for Part B, the way that penalty works is for every 12-month period you went without Part B, but you could have had it or should have had it, you're going to be penalized 10% of the premium. Whatever the premium is that year that you enroll, 10% times however many years you delayed. So, for example, if you delayed 3 years, you weren't working, you just decided you didn't need it for whatever reason, when you go to enroll 3 years from now, they're going to multiply 10% times 3 years, so you're going to have a 30% penalty. That'll be calculated times the monthly premium, $185, whatever that comes out to, will be tacked on top of that monthly premium every month forever. That penalty never goes away. The premium does increase every year, but the penalty would stay the same. Part B does have a deductible. It is a one-time-a-year annual deductible, a drop in the bucket these days, $257 annual deductible for Part B services. Once that deductible is met, Medicare pays Part B coverage and services at an 80-20 split. Pretty simple. And again, if you have a higher annual income, your premium may be means tested, and they base that on income ranges. So for 2025, if you're a single person, the limit is $106,000 a year. For a married couple, it's $212,000 to start. Anything over that, and you're going to be paying a higher Part B premium. They're going to base that on the most recent complete income tax filing from the IRS. So they're not going to be looking at what you make today. They're going to be looking at what you filed for taxes 2 years ago. Because we're just now getting ready to file 2024. Hopefully your 2023 taxes is complete and closed. That's what they're going to look at. The MAGI income, modified adjusted gross. Yep. So they're going to be looking at everything. Now, I do get a lot of people who, when Social Security looks at that, they see 2 years ago there was a significant income. Halfway through the year, that person stops working. That income is significantly reduced. You can apply to Social Security and let them know that you've had a change, a life change, and your income is reduced. And there is potential that they could reduce whatever penalty you might have been paying up until that point. But they do look at that every year. So as your income changes, that penalty or that extra amount may change, may go away down the road. So it's not like once it's on there, it's forever. They review that information every year and adjust as needed. Any questions about any of that? Okay. So we'll talk about real quick what Part B covers. Again, Part B covers outpatient. So it's going to cover office visits of any and all sorts, all your x-ray and lab work, MRIs, PET scans, covers all medical, surgical, and anesthesia services. Medicare will cover medical second opinions. Covers your ambulance rides, if they are emergency rides. Part B will cover replacement blood starting at pint number 4, because again, no part of Medicare covers the first 3 pints for some reason. Covers all your annual vaccines, flu, hepatitis, pneumonia, shingles, COVID. Although for some of those shots, some prescription shots, like the shingle shot, that is split up between Medicare B and D, so that the drug itself is covered under prescription coverage of Medicare. The administration of that shot is covered under the Part B of Medicare. So they have to bill two separate parts. Covers all your outpatient physical, occupational, and speech therapy requirements. Covers durable medical equipment. That includes wheelchairs, walkers, oxygen, that kind of stuff. And there is limited coverage for other services such as chiropractic, podiatry, that kind of stuff. The key for Medicare to pay for anything is medical necessity. If your doctor says you absolutely need to go have this service, he's going to tell Medicare it was necessary. If the doctor is not able to tell Medicare that whatever they're having you do is not 100% necessary, Medicare may not cover it regardless of whether or not it's a benefit of Medicare. So medical necessity is key for Medicare to pay for anything. And if there's ever a question about whether or not Medicare will cover something, so for example, if your doctor says, you should probably go get that taken care of, but he's not telling you to go get it taken care of, that's a red flag that says Medicare may not cover whatever he's suggesting you go take care of. Always, always ask if there's a question. Don't hesitate to ask the doctor, will Medicare pay for that? And they should be able to tell you. If they're not able to tell you off the top of their head, ask them to find out. It's their job. They're the ones who are going to be telling Medicare if it's necessary and not based on the codes that are submitted. But as with all things, there are some things not covered by Medicare Part B. That includes routine physicals, routine foot care, hearing aids or the fitting of them, routine eye exams for prescription glasses or the glasses, and even for medically covered eye care. If you get a refraction of your eyes, that is not covered by Medicare. Medicare still does not cover dental, and it will not cover anything considered cosmetic or non-medical, non-necessary. So Medicare does not cover annual exams or physicals. Foot care, if you just can't reach your own toenails, but you don't have another reason for a doctor to take care of your toenails, that kind of stuff, Medicare will not pay for it. However, if you are diabetic, have cardiovascular disease, have some medical reason that doing your own foot care could be potentially require medical professional, Medicare will pay for foot care. Hearing aids, Medicare will only pay for hearing services in rare situations such as they're trying to diagnose maybe a neurological situation. Eye exams, Medicare covers medically necessary eye care. So if you're developing cataracts, glaucoma, poke yourself in the eye with a pencil, Medicare will cover those services, but they will not cover you go into the eye doctor to see if your prescription glasses need to be upgraded. Dental, that was on the table for a minute. I thought they were seriously going to start talking about it for a minute. That didn't last long. So it's still not something that Medicare itself covers. And then, of course, cosmetic is not going to be considered necessary. On the other hand, Medicare did jump on the preventive services bandwagon when preventive services became the big thing to offer several years ago. And now Medicare covers a lot of services that they can deem preventive, and they will pay 100% for them, 100% coverage. Instead of a routine annual physical, what Medicare does provide is when you first get Medicare, they will pay for a welcome to Medicare visit. And after that, or if you don't use that welcome to Medicare visit within the first 12 months of having Medicare, every year after that, you can still use the annual wellness review visit. Both of those visits are not physicals. There will be no lab work. There will be no getting on the treadmill. They are in-depth conversations with your doctor to talk about your health history, your family's health history, your social history. your current medical needs situation. And it gives that doctor an opportunity to suggest preventive screenings that you may want to take advantage of in the coming year. But that's all those visits include. And you have to be very specific when asking for those visits. Now, if you go to a doctor only once a year to have that doctor write you a new script, renew a prescription that you've been taking for a while, that is not going to be considered a preventive visit because you're there for a medical need. That doctor to renew that prescription for a medical condition. So if you're only wanting to take advantage of these wellness reviews or preventive visits, you have to be very specific when you schedule that appointment with your doctor. Otherwise, they bill it wrong. And there are tons and tons of services that Medicare will cover now at 100% under preventive care. In the Medicare and You Handbook, there's about a 25-page section that details all of those services and all the specifics, how often you can get them, what the criteria is to qualify to get them. All of the preventive services are indicated by that little blue apple symbol within that booklet. And you can either, we have booklets hard copy here that you're welcome to come and get, or you can go to the Medicare website and view it as a PDF. Once you're enrolled in Medicare, you will start getting that Medicare and You Handbook mailed to you every year, at least until everything goes digital, and then they'll just email it to you. But the year that you become eligible or enrolled in Medicare, you don't get it. All right. That is Part B benefits in a nutshell. Any questions about any of that? No? You guys ready to take the test? All right, we're almost done. The last thing I want to talk about briefly is there is financial assistance programs available for people specifically to help cover the costs of Medicare. So if someone has limited or low income, there are programs that can help pay the Part B premium so that that amount is not deducted from Social Security. And at the lower income levels, it can also pay the Medicare deductibles and the co-insurances, the balances that Medicare left over. There are income and asset limits to be eligible for that assistance. And those programs are typically applied for through the Department of Human Services. Is basically a Medicaid application, even though technically it's not Medicaid. If someone's already on Medicaid, they automatically get that assistance. There's also assistance available for a separate program available for just Part D benefits, the drug benefit of Medicare, that has higher income and asset limits to qualify. So more people can qualify for drug assistance than for the A and B assistance. And we'll talk about that when we get to Part D on week 3. There is a handout in your folder or in the email that gives you the income and asset limits. I just updated the handout for 2025. I didn't get time to do the slide. And if anybody wants any additional information or wants to talk about these programs in any more depth, please give us a call because we do help with these applications. And that's it. So again, this is a free advocacy program available nationwide. If anybody wanted more information about this program in general, you can go to the SHIP TA Center or shiphelp.org. And it will tell you all about this federal program. Medicare does have an ongoing survey where they can call you and ask you if you benefited from the services of your local SHIP. And we do appreciate people who complete those surveys because it does go towards whether or not we get funding. This is a totally grant-funded program by the government. So honestly, right now I'm a little scared because we're on the chopping block, but we'll see how that goes. We also have another sister program called SMP, Senior Medicare Patrol, that does education on fraud prevention for Medicare and Medicaid. So we do education and assistance. We can help people identify fraud. We do presentations to educate people how to identify fraud. We can help people if they think their doctor's trying to bill Medicare for things they never got. those kinds of things. So that is also grant funded. We're always looking for volunteers. That's honestly one of the funner things to volunteer for when it comes to Medicare. Not that any of it's overly fun, but that can be entertaining. And so anybody who is interested in volunteer opportunities, more than welcome to contact me, and I'm happy to talk to you about it. I did include a volunteer handout in your packets. And that's it. I'm open for questions. Okay, so free gym memberships like Silver Sneakers, which was the bedrock of gym memberships for many, many years. Those are only available primarily through Medicare Advantage plans. And we're going to talk in depth about Medicare Advantage plans and Medicare supplement insurance next week, so that there's a very clear distinction between the two. There are a lot of advantages to Advantage plans, but there are some disadvantages as well. But we're going to talk about all of that in depth next week. 5:30. Our apologies for the mix-up today. But yeah, it was supposed to be 5:30, and the registration was incorrect. We just got it mixed up, but it will be 5:30 next week. All right.
Roma, William did have one question in the chat.
How do you evaluate current employee group insurance to understand that you would qualify to delay enrollment in A and D or B and D? The bottom line is, as long as you're actively employed, you have insurance with that employer, and that employer has more than 20 employees. That's all you need to know. If you meet those 3 criteria, you have credible coverage in order to delay Medicare A, B, or D without penalty. Period. Simple as that. So it doesn't matter what kind of insurance you have or how it works, is if it's through an employer, through active employment, and there's more than 20 employees, you're good. Cool. All right. Yes, everybody got an email with a copy of the slides and all the handouts electronically. Absolutely. And I will do the same thing next week for any slides and handouts for next week, for every week. Cool. Well, I appreciate you guys taking the time to come and attend this presentation. I know this is not the most exciting topic in the world to talk about, but it is important, I think. And that's why I've been doing it for as long as I've been doing it. I think it is very important to make the right decisions, because this is potentially your insurance coverage for the rest of your life. So you want to make sure you make the best decisions and understand what you've got and what you don't have. So again, thank you all for attending. We appreciate you. We hope to see you next week. I will be sending out another email next week with next week's slides. And if you receive the email from this afternoon, you have my email address. You're always welcome to contact me with any questions or concerns in the meantime. Otherwise, I hope to see you next week.